Joining us now, Dr. Sandra Belmont. She's an ophthalmologist and director of the Laser Vision Correction Center at New York Presbyterian Hospital. And Dr. Belmont participated in the trials on the laser surgery procedures for near and farsightedness. Good morning,
Good
Doctor.
morning.
Explain farsightedness to us.
Well, farsightedness has to do with the fact that the eye is actually a little too short for the focusing to occur.
You brought an eyeball
I have
with
an eye here, yes.
Okay.
The condition is known as presbyopia, and an estimated 90 million Americans either have it or will develop it in the next 10 years. So what can you do to reclaim your sight? Dr. Sandra Belmont of the New York Weill Cornell Medical Center is here with some answers to that. Dr. Belmont, good morning. Good to see you. I am right in the middle of this. I mean, Katie and I joke about it all the time. I can't see here, but I can see great here.
That's right.
So I'm not alone. This is happening to a lot of people.
If you live to be 40 and older, you'll have to deal with this.
I've had people tell me that there are things you can do at a younger age to help prevent this, like read in better light or eat foods with a lot of beta-carotene.
No, that's not true.
That's a myth.
This is a natural process as your eye matures. I prefer to call it maturing rather than aging.
Okay.
Yes.
All right, so this is going to happen no matter what.
No matter what.
Let's talk about treatment options then, and there are basically two ways to go about this. The most dramatic is with surgery, and we're not talking about surgery to lengthen your arms.
No.
We're talking about on the eyes. And who's a good candidate for surgery and who's a bad candidate?
Mostly everyone over the age of 40, if they have a normal eye exam, their corneas are within normal limits, will be able to have this treatment done. We can do.
Dr. Greg Harmon, who is the director of the glaucoma service, and Dr. Sandra Belmont, the director of corneal service. And I happen to know these people personally because I don't know if you folks remember this, but a couple of years ago, it was a very, very dark time in my life. I came down, I was stricken with something called the shingles. And it got a hold of this nerve. It's called the trigeminal nerve, and it gets around your eye, and it can go right into your eye. And so anyway, I had to go to these people, and they were concerned because the evil shingles get into your cornea, and then it's Katie bar the door, or literally, it's lights out. Forget Katie bar the door. That has nothing to do with this. Oh, man. But anyway, they saved my vision, and they do a wonderful job over there. It's Dr. Greg Harmon and Dr. Sandra Belmont.